Welcome to Elevated EMS Education, where we raise the standard of emergency training. In this Sketchy Medic lesson, we're covering one of the most powerful life-saving tools you'll ever use, the AED. Whether you're a new responder or taking BLS for the first time, learning how to use an AED correctly can mean the difference between life and death. Step 1. Power on the AED. Most AEDs have either a simple power button or they turn on automatically when you open the lid. The moment it powers on, the AED takes over. It begins giving you clear voice prompts, guiding you through every step. Remember, don't overthink it. The AED is built for responders under pressure. Turn it on, listen to the prompts, and let the device lead you. Step 2. Apply the pads. Expose the patient's chest, remove any moisture or clothing, and place the pads as shown, one on the upper right chest, the other on the lower left side below the armpit. Ensure full contact with the skin. These pads let the AED read the heart rhythm and deliver a shock if needed. Step 3. Analyzing the heart rhythm. Once the pads are in place, the AED will check the patient's heart. Make sure no one is touching the patient during analysis. The device will tell you what to do next, either to deliver a shock or begin CPR. Stay calm, listen closely, and follow the prompts. Step 4. Deliver the shock. If the AED advises a shock, make sure everyone is clear and not touching the patient. Loudly say "clear," then press the flashing shock button when instructed. After the shock, immediately start CPR. The AED will guide you through compressions and timing. Stay focused and follow the voice. Step 5. Continue CPR and follow the AED prompts. Begin chest compressions right after the shock or when instructed. Keep your hands centered on the chest. Push hard and fast, about 100 to 120 per minute. The AED will reanalyze every 2 minutes. Stay calm, follow its cues, and don't stop until help arrives. Step 6. Save a life. You've powered on, applied the pads, followed the prompts, and stayed focused. That's how you give someone a real